Joe Biden, cancer. Former President Biden has an aggressive form of prostate cancer, one that has already spread to one bone in his body, maybe more, but at least one. What we're learning about his condition and possible treatment options, as Vice President Vance, as you just heard, questions Biden's past health while serving as president. Meanwhile, President Trump is seeking to seal a deal with House Republicans. He's going to meet with them tomorrow as the 1,000-plus page bill, with much of his agenda in it, heads to the all-important Rules Committee. You got to go to the Rules Committee before you can take it to the floor. That Rules Committee is scheduled to meet to consider this legislation at the amazing hour of 1 a.m. Wednesday morning. Before then, though, sticking points, significant ones, have to be resolved. Some of the most conservative House Republican members still not sold on this bill, which has, among other things, Medicaid work requirements, tax deduction known as SALT, and cutting elements of the Inflation Reduction Act. There were phone calls for peace today. President Trump held dueling phone calls with his Russian and Ukrainian counterparts. But with recent Russian strikes in Ukraine, the question still remains. Is there any serious effort, especially on the Russian side, to achieve a ceasefire and a possible end to the war started by Russia in 2022?
We just spent 2.5 hours talking to Vladimir Putin, and I think some progress has been made. It's a terrible situation going on over there. 5,000 young people every single week are being killed. So hopefully we did something.
We will get back to the Putin phone call in just a minute, but I want to start tonight with Gómez right here at the desk with me and Aaron Navarro in Wilmington, Delaware. Aaron, it's great to have you with us from Wilmington, Delaware. Catch us up on what we heard today about former President Biden's condition, possible treatment options, and the steps ahead.
Major, good afternoon. From about a bit over a mile from President Biden's home here in Wilmington, where CBS News has learned from a source familiar, is where he's staying as he and his family continue to consider the treatments. Now, we have heard no specific update on their choice of how to move forward, as well as where they would do it. As Finn actually reported last week, President Biden went to a hospital in Philadelphia to initially get the test done, and that's where they found that growth in his prostate. What we've heard from medical experts, at least, are hormonal, in terms of potential treatments, are hormonal treatments to suppress testosterone levels in the former president, chemotherapy, radiation therapy. We know that clinical trials, though, is something that President Biden, when he was in the White House, really championed as part of the Cancer Moonshot Initiative, looking and waiting to see if that's something he would also opt into.
So, Finn, since your name was just invoked by Aaron Navarro, tell us what you know and what you reported last week and the context that provides for what we found out over the weekend.
Yeah, no, what we reported last week was what, just echoing what Aaron just said, but that, that he had undergone some tests in Philadelphia, at a hospital in Philadelphia last week. They found some nodes on his prostate they were concerning, so that needed to be further evaluated, according to sources from the former president's office. We're also, just one thing, I've been talking to some top Democrats throughout the day today concerning this, and there's been, as you've seen, even externally and publicly, a great deal of empathy and sympathy, what you're seeing towards the former president from the party, and it's sort of paused some of these questions that we have been hearing over the weekend, revolving around the Alex Thompson and Jake Tapper book, that really question his mental acuity. And I just wanted to say that there's been a sense of to keep those two separated at this moment. That's really they're not exactly the same in terms of what's the questions that are being raised about his health overall.
Well, it may be calming down among Democrats. It is not calming down with the Vice President of the United States. Let's play some sound from J.D. Vance as he came back from Rome on Air Force Two.
We really do need to be honest about whether the former president was capable of doing the job. And that's no, that you can separate the desire for him to have the right health outcome with the recognition that whether it was doctors or whether there were staffers around the former president, I don't think he was able to do a good job for the American people.
So, yes, that's a political observation about the job he was doing, separate from his healthfulness while doing it, but also central to this conversation, and is not going to go away, even if Democrats think that this might create a momentary pause.
Sure.
The ability of this president, President Biden, to fully serve out the next 4 years, which he was running for, remains a question Democrats are going to have to reconcile themselves to. Were you setting the nation up for something that could not actually be carried out?
Exactly. And
by talking optimistically about a Biden re-election campaign before it ended.
And as the Thompson and as the Tapper book portend, and as previous books portend, just like from John Allen and Amy Parnes, The Fight, was there a sense, a cover-up from those surrounding the president and blocking like information that was going towards him, but also like more severe concerns that have been reported out, not just from these books, but from other outside reporting, that there was some sort of protection, and whether it be ethical or not, like that there should be more of a spotlight on that.
Aaron from Wilmington, Delaware, any insights from you based on your coverage of the 2024 campaign, conversations in and around this topic, which was persistent, but not nearly as much in the rearview mirror as Democrats possibly would now admit it should have been?
Yeah, that's right. In fact, even potential 2028 Democratic contenders are still grappling with questions about President Biden, whether or not he should have dropped out earlier in the race. And just from talking to a small but a quick snapshot of residents here in Wilmington, I met 2 people who supported President Biden but believed that he should have left the race. And I met another woman who said she has known President Biden since he was a Delaware senator, that said she would have voted for him even if he was in a wheelchair. But predominantly, the conversation about President Biden's health has steered more towards trying to get some accountability from the Democratic Party. And it's just striking again that President Biden's post-presidency, which compared to maybe former President Obama or even a Jimmy Carter, will just be shorter given his age, and it'll largely be defined about his health. Of course, that diagnosis of prostate cancer is another addition to that.
Aaron Navarro in Wilmington, Delaware, Finn Gómez with me at the desk. Thank you both very much. CBS News medical contributor Dr. Céline Gounder joins me now. She is also a senior fellow and editor-at-large for public health at KFF Health News. Dr. Gounder, always a pleasure to have you with us. I have read from some experts in this field that it is quite possible, if not probable, that President Biden had this condition for quite some time and that it wasn't tested or diagnosed, but it would have been there for this to be at this advanced stage. How do you evaluate that line of reasoning?
It's really hard to say, Major, because we stopped routinely screening men for prostate cancer after age 70. And so it's certainly possible that he has not been having routine PSAs, which is the blood test that you use to assess for prostate cancer. He may not have been having routine prostate exams. Now, we do know back in 2019, he did undergo surgery for what's called benign prostatic hypertrophy, which is a benign, so not cancerous, enlargement of the prostate. Whether that was done using laser or just straight up surgery, we don't know. If there was tissue from the OR, that would have been sent for pathology. So if there was underlying cancer at that time, that would have been diagnosed and picked up then. But then presumably he would have received treatment to prevent the further spread to the bones.
And Dr. Gounder, would it have been possible for this to have been detected through the standard PSA testing regimen?
It is possible, assuming he had PSAs performed in the last several years. Again, that's not the routine after age 70, and it's because most of what we pick up after age 70 is very slow-growing, not what's going to be killing people. And so it's really weighing the risks and the benefits of testing and treatment in somebody in whom prostate cancer may not be the cause of death. We know many men, in fact, die with prostate cancer, not from prostate cancer.
And very quickly, as President of the United States, one would think that everything would be rigorously tested, and there's a family history of cancer.
There is a family history of cancer, but that doesn't mean that you're at risk for all cancers. And so the cancers for which you are screened is really based on your specific risks, which ones, your age, and factors like that. And so there's not an indication that he should have had increased screening for prostate cancer over anybody else.
Options going forward.
So options going forward, as was outlined just now, hormonal treatments, which include testosterone blockers, so medications like Lupron and Zytiga. In addition, medications that are targeted at the bones, because we know he's had spread to the bones. Chemotherapy may be on the table. Radiation therapy, in particular, with, again, the spread to the bones, may be on the table. But we just don't know enough in detail to say which options will be offered to him.
And very quickly, prognosis?
Prognosis, the treatments for prostate cancer are so much better now. And he has a hormone-responsive prostate cancer. And so he could live another 5, 7, 10 years, assuming something else doesn't happen to him between now and then.
Dr. Céline Gounder, great stuff. Thank you so very much.